What's going on, good people? July is National Minority Mental Health Awareness Month. Hey, what's going on, good people? It's your boy James Harris, founder of a movement called Mental Heal, author of a book called Man Just Express Yourself, which is an interactive planner tool for boys and men to better express themselves. I'm definitely appreciative of my fellow clinicians who got this book and use it as interventions and tools throughout their therapy sessions or just have it in our lobby as a conversation starter. Salute to the parents. Let me just remind you that school is approaching, so get this tool. Continue the summer working with your young one. Couples, I like the feedback that you're doing this as a date night activity. You're talking with each other. You're exchanging dialogue on those tough conversations. Keep that up. It's definitely important. Continue if you want that. Definitely go to Barnes and Nobles, Target, Walmart, Amazon, pretty much anywhere books are sold. Be sure to like, share, subscribe. Submit me your questions if you have them. I definitely try to get around to them. I even make a video if you need me to. I definitely appreciate you. So again, July is National Minority Mental Health Awareness Month, also known as BIPOC Mental Health Awareness Month, which is definitely people within the field, within this, throughout the field, is working tirelessly to shed light on mental health needs of the Black community and other underserved and underprivileged communities based on so many disparities within that subculture. So we're talking about community development systems that support and create to fill the gaps within traditional systems that may have overlooked culture, historical factors that impede minority mental health. Those things are important. Let's explore 3 different topic areas where I got you. So I just want to make sure that we're touching on community care, self-directed care, cultural care, and why these cares are valid and valuable, the choices that people make for their own mental health, specifically for minorities and people of color. So when we're talking about community care, this refers to different communities of colors that have provided support for each other. Like when we didn't have those allies, we had to rely on each other. We had to engage with each other. We had to be a close, tight-knit community. This can include mutual aid, peer-to-peer support, healing circles. Like it's so many different things now that we do within specific communities to ensure that we're uplifting our own community, because for a long time we didn't have those resources. Moving forward, when we talk about self-directed care, this is an initiative or practice that emphasizes that people with mental health and substance use conditions are being respected if they're applicable to different services. You know, they having a decision-making authority or services they receive. Like, you're important. You're able to now voice your own opinion, seek services, and be an advocate for yourself if no ally is there for you or no advocate is there for you. One of my favorite ones, now the third one that I said I was going to mention, is cultural care. This refers to the practice that are embedded in the culture that are passed down through generations that naturally provide resiliencies and healing, especially within the community, especially within your work environment or your family itself or on your team. Something that I always say is cultural competence is cool, but being from the culture is even better. So find you somebody who look like you who's providing a service. Tag somebody who look like you that's providing a service. Lastly, in closing, go out and review some statistics on minority mental health, and so you can figure out why it's important. So you can see that there's so many disparities within this community. So you can see there's a lack of funding. It's a lot of therapists and clinicians who are of African American descent or a minority population, indigenous, that are often overlooked because of systems that are in place. So do me a favor, like, share, subscribe, submit me your questions. Let me know how you feel. Did you know July was Black Mental Health Awareness Month? A lot of people didn't.